So I'm a trained endocrinologist working as a clinical doctor in the Faroe Islands. So I consult the persons with endocrine diseases. And I prefer to call myself as a hobby researcher. So I do some research in my spare time. Yes, what we observe in the clinic when we see a person with thyroid diseases, I often find that they also have inflammatory bowel diseases here in the Faroe Islands, and I haven't observed this in other places where I've been working. So I think this is something might be unique to the Faroe Islands, but I don't think so, but might be the prevalence of both the thyroid diseases and the inflammatory bowel diseases is higher here, and that might be the reason. So I think we have the potential with meetings like this, when we meet persons that are researchers in other areas that are tiny area where we deep in, and I think we can collaborate and might look at both of the diseases, especially here in the setting of the Faroe Islands, which is unique by it is small and we collaborate closely in the clinics, so we could also do that in research. The opportunity to talk like cross-disciplinary, both with researcher, doctors, and persons living with the diseases, I think that is a very unique opportunity. And we can discuss what is most important for the person living with the diseases, as we heard in a previous talk. Also, how the community handles people with the diseases. In this case, small issues like access to toilets is very important. So I think for persons living with IBD, I think it is important to know about there is a coincidence of thyroid disease. It's not only found in the Faroe Islands. There are other researchers on that area doing research for that. So I think the knowledge that if you don't feel well, then maybe you should check your thyroid parameters as well. So I see that there are a lot of funding for another area. What I work in is diabetes, and inflammatory bowel diseases have some fundings, but in the thyroid area there's a really shallow amount of money. And also the thyroid diseases, it is mainly or mostly a female disease, and we know a lot of research funding goes to addressing men's health and not that much into women's health.